While a vast majority of countries worldwide, including Guyana, are presently hosting successful COVID-19 vaccination campaigns for their children population, they continue to do so without the support of the Pan American Health Organization and the World Health Organization, as was stated by Dr. Etienne on Wednesday during a virtual press briefing. Guyana's vaccination drive for children began in August 2021 following the FDA approval for the Pfizer vaccines to be used for children ages 12 to 17. So far, 27,954 children have received a first dose of the Pfizer shot, representing 38.3% of that population, while 19,028 children have received both shots, representing 26.1% of that population. Even so, Dr. Etienne shared the belief that with the low vaccine availability, countries should be prioritizing their vaccine allocation.
It is best to protect the most vulnerable first. Once those at greatest risk are protected, the next step is to immunize a high percentage of the adult population. Only afterwards should countries consider vaccinating younger groups.
The local Minister of Health, Dr. Frank Anthony, recently said that this exercise will commence in the country very soon, since the schedule for its administration is near completion. It is expected that once the vaccination for this age group is rolled out, it will further push the country to achieving herd immunity. Meanwhile, countries were also tasked with building a more resilient medical system, since according to the director, healthcare systems have been significantly weakened due to the COVID-19 pandemic.
Our health systems should be properly managed and guided by evidence to ensure that they are effective and can keep us safe.
It was conveyed that over the past week, a total of 700,000 new COVID-19 cases and 13,000 deaths were recorded in the Americas. As for Guyana, over 500 new COVID-19 infections were recorded in the past week. The local Minister of Health has since said that cases in Guyana are on the decrease, with less than 60 persons presently receiving care at hospitals in the country. So far, the government has been building capacity for any new COVID-19 wave. This is evident through the recent expansions of COVID-19 related services at regional hospitals to cater for patients infected with the disease, along with the ongoing construction of the prerequisite infrastructure foundation that will house the country's oxygen plan when it arrives in the country. For the HDP 90 News, Kendell Richmond.